Kim Grant here, and welcome to another Friday from the Field, where I'm actually in the field somewhere in Louisiana with Lake Charles Memorial Health System. So we like to say that onboarding is not just orientation, but that it starts way before the recruitment process and goes well after they are onboarded and with our system, because it's all about retention. So with that, we brought together, I'm gonna say, 50, 60 people from the health system into one room. And we went through the process of onboarding from each of their parts of the onboarding process, where they were able to tell us what they did. We were able to share that information and then really look at some best practices, maybe find some duplications, and sort of tighten up that process and really look at it through the eyes of the onboarding provider so that we can make that to be the best possible experience for them. So with that said, two of my colleagues that have joined me here from Lake Charles, I'm just curious, and I'll start with you. Please tell us your name and your role and sort of what stood out to you the most in this process, really the past 2 days.
Absolutely. So I'm Cecily Sheets. I'm the practice administrator for primary care and women's services for Memorial Medical Group. Some of the things that stood out to me about this process was just the level of engagement of the team. It's something that just unprecedented, something we haven't seen here before in a good minute, and really focused on a powerful point of interest. I mean, our physicians are the center focus of providing healthcare services to our community, and it's something that we're just so engaged and driven to improving in that process and making it a meaningful experience for them. We got to allow the practice managers from all of the clinics to have a seat at the table. Many of them have not before had the chance to be a part of the recruitment process, and seeing their insights and ideas and allowing that to transcend into some of our plans of action was extremely powerful and really exciting. It's a very exciting time here.
That's awesome. Well, I loved your presentation because you talked about, and you're probably the one who's recently onboarded someone, a month ago?
Mm-hmm.
So a new OB provider. And so would you say that her experiences was good through your eyes? And what feedback did you get from her?
Yeah, I would say her experience was really excellent, and definitely, as we started this process, even before we started this process, she had made a comment to me about, wow, I have never felt so welcomed. And so, we definitely have some opportunities to grow that we addressed and learned and were illuminated here today in this activity, but her experience was good.
That's awesome. All right, tell us about you and what you thought from these last 2 days, and I'm talking full 2 days.
Full 2 days. It was very daunting at first, seeing the agenda, to think that I could sit somewhere for 2 days in a row, 2 8-hour days. I'm used to moving a lot around. I'm a surgical services director here at Lake Charles Memorial Hospital, and the 2 days brought together and put into focus exactly all the stakeholders and made us all shareholders in the ability to recruit, maintain, and promote our system, which it quite honestly is one of the best in the area, in a 5-parish area. And it just put a twist on it, as opposed to being I'm in a clinical as opposed to a clinic. We always looked at ourselves as an end user. We dealt with the physician that was found for us, and we provided a service, whereas now it made myself and a lot of the other clinical directors that were here to be part of the process, to truly feel vested in making a difference in the future of the system.
That's awesome. Well, we identified in those 2 days over 100 action items and lean process improvement things we can do here at Lake Charles. So we'll continue down this path, and we'll be back on site with you all and sort of talk about how we've been able to make those improvements, with the goal of really getting a very nice, clean onboarding process for the providers that come on in the future. So I appreciate both of your engagements, because it is a long 2 days, but we'll see you back in a couple of weeks, and we'll continue the process. Have a great Friday, everyone.